Just to ground everyone, maybe everyone knows, but you have Natalie and myself from the Institute for Intergovernmental Research, IIR. And IIR is one of several training and technical assistance providers within the Comprehensive Opioid Stimulant and Substance Use Program, or COSUP, which is a Bureau of Justice Assistance program. And I think maybe if people can mute, just there's a little bit of background. I don't know if others can hear it. And so the COSUP program, which I mentioned through the Bureau of Justice Assistance, has several training and technical assistance providers and several tracks of support within that. And so Natalie and I sit in the overdose fatality review and also expansion into suicide fatality review lane. And our funding is blended funding through BJ and CDC. Although, well, I won't go into it. And so Natalie is part of several team members that we have here at IIR that you probably have interacted with over time. And Natalie really is instrumental in supporting the overdose fatality review data system. So we are here to give an overview of the data system and discuss how to access it, what it's like once you access it, and the benefits of using it. And we have a very informal discussion presentation, but it's still rich in content. It just makes it, I think, easier to allow for a more dynamic conversation than us necessarily just going through slides. So feel free at any moment to type in your questions into the chat or raise your hand, and I will do my best to monitor, and then maybe Indira and Natalie can also help and then if we miss something. But before we begin, I just am curious how many people have had a chance or have heard anything about the OFR data system before I begin? Like they've gone to a webinar. You can either do your virtual hand or you can do your real hand. Okay. Okay, fair number of you, good. And how many of you have been able to, sorry, I'm getting a call. How many of you currently are operating an OFR? I can see a raise of hand or a type into the chat. Okay, Indira, do you want to give a little overview for me just before we ground of like the status of OFR in Illinois and like how many are currently and how many are thinking?
Sure.
And then sorry to make you be a part of this conversation. No, you're like, I wasn't prepared.
Fine.
Yeah.
No, you're fine. We have 2 active OFRs right now, one in DuPage County, where Alex Pulaski's from, and one in Kendall County. We have a couple that are actually, I think, pretty much ready to get going. Sarah Mendoza from Kane County is actually the new OFR program manager for their county, which is nice, and dedicated to their OFR. Michelle Myers also from Kane, so they're about ready to go. I think Sangamon and Winnebago are also building out teams at the moment. So altogether, I think we have about 17 counties that are interested in OFR and about 7 counties that are actively building teams.
That's amazing in the last year plus what's happened.
Yeah.
That's great. Okay. All right. Well, I think I'm going to do our general overview, and I think that's what we're asked to do. So, you know, if you've heard some of this, hopefully it's validating for you. If it's new to you, feel free to ask questions. But one of the things we've realized early on when OFR began to have national resources and guidance was that there was a need to have a standard data system or tool to capture information across all the different OFRs. So one of the things we did in 2019, just to understand the roots of the data system, is we had our first nationally supported forum. And it was in DC, and it was just when COSUP started funding TTA provision of overdose fatality review. And at the end of that first forum, we had people come together afterwards that were researchers, epidemiologists, federal agency, current OFR sites, and we discussed what needed to be included in the national data system. So this OFR data system, it was really designed by the field for the field. So it was really informed by practice. And I just want to confirm that the hands up are just leftover hands up in that question. Is that true? Robert or Jennifer, do you have a question or no? No, okay.
No
Okay,
question.
perfect. Okay, perfect. So what we did is we had everyone talk through what categories of data were important, like who were the stakeholders they were bringing to their meetings, what type of information. And from there, we really did an intensive 6 months work group style where we went through and tried to identify what were some core questions or data elements that we wanted to capture. The important thing was that we wanted to make sure whatever we developed, if it already existed in another data system, that we brought that over. So if it was questions around the death, we went to the National Standard Death Certificate and said, what are those elements there? And let's bring them over. Let's not make our own new similar type questions. Let's standardize this. We looked at the National Violent Death Reporting System, Suitors State Unintentional Drug Overdose Reporting System, and we try to bring over standard questions. Having said that, a lot of the questions are not from an already existing tool. They don't exist out there, which demonstrates the value of the OFR. It is capturing new information. And the other thing we did when we designed it, which is different than a lot of systems, is we decided we were not going to have any required question and that we were going to really only have reported what is known. So we don't have unknowns throughout it because the review is about someone's life who, someone who died. And so it's really hard to know the true number, the true events. So we knew we were only going to be able to get the floor. And so everything is what is known. We have the word known in it if it's a number. So how many known non-fatal overdose deaths or non-fatal overdose events happened, right? So we didn't want unknown because it's really unknown for everyone, right? So, and this comes from my work doing the violent death reporting system, where I would really struggle seeing people write reports and say, only 30% had a prior treatment. You're like, well, no, we only know of 30% having a prior treatment. We don't really know we only know the floor. So I just give you some of that grounding. So when we went through, we also knew no OFR team was going to have all the data. And so we didn't want you to have to go through and go unknown, 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 unknown. If you don't have law enforcement there, if you don't have a law enforcement partner, you can skip the law enforcement partner section, right? So everything while it looks big, it's really only as big as the data you have. The other thing I want to say before I show more to you is that while it looks big and it's only the data that you have, it's not designed to be filled in completely. It is designed to capture the information that was discussed in your OFR meeting in a standard way. So why am I saying that? What I don't want you to feel like is you have to be like, did we get that question answered? Did we get that one? 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 It should be a cue to you to the type of information you want to gather, but it's not like expected to be the driver of your OFR. Does this make sense? Your OFR should be a co-created discussion and understanding of the decedent's life and all the touch points and areas where there could have been a missed opportunity for prevention or intervention, or those data points where maybe when you align, you realize there were periods of time where there were some real intentionality would have been useful in intervening, right? It is, and then you capture that. You don't capture everything in the data system and then bring it to your meeting. Does this make sense? It's like, it's really meant to be like the storage of everything you learn versus a driver of everything you talk about. Questions about that? Sometimes people are like, what does she mean by that? Okay. Having said that, it can be kind of a cue, like, hey, you don't really have very much data on behavioral treatment. you might, like substance use disorder treatment, you might want to pursue and get a little bit more because you seem to be lacking that information on all your case reviews. So it should be kind of a guide of, oh, I never thought to think about life stressors or trauma. Maybe we should be incorporating some of those questions in our conversation. But you don't really want to bring the print off and go, okay, we answered every question but 7A. Okay, that's not how it was designed. Okay, so after we did this initial build up and pilot, we pilot tested it. We did some pretty rigorous analysis. We had a follow-up with all the pilot sites in the field, and we did a modification to make sure it looked more like what the field wanted. And that's where we are today. So we have 4 components. We have the case information, which really captures all those touch points and information you learn about the decedent and their experience in a standard tool. Then we also have a community context. It's really a county profile. It tries to capture some of the social determinants of health, tries to understand OD map utilization. It's kind of our attempt at a quick needs assessment scan. It's very minimal, but it's really there to remind folks that all of their case reviews should be done with the understanding of the community that the case is coming from. And then we have a recommendation section. I'll show you all these, but this is where you capture all of the suggested ideas for change in the community. It could be changes within your OFR. So it might be like, ooh, we really should have the VA representative at our meetings. Okay, that's a recommendation that should be captured. It could be a policy or procedural change within an agency. So maybe there is a request that in the intake, there'll be a review of prior treatment, MOUD treatment. Maybe that wasn't in a procedure. That would be a recommendation within that agency. Maybe there is a recommendation across systems that there will be a warm handoff from agency X to agency Y. Another recommendation, though, might be a state recommendation. It might be that the state should have a dashboard where you can see where there are places to access naloxone for free. I'm making all this up on the fly on Monday morning. So if you're like, what is give me a little okay, I get the gist. It could also be a national recommendation. It could be a recommendation around there should be more funding to support training around W through federal programs. So I say this to you because there's no one, when people say, well, what are OFRs doing? OFRs are doing all of that. They're doing things from changing how data are collected and processed and discussed. They're changing how organizations are functioning across systems, and they're changing and making recommendations to state and national that are going to probably be long-term, but are really informing some decision makers in regards to potentially allocation of funds or prioritization of efforts. And so as you form your OFR, all of those things should be captured because you want to show the short-term benefits and changes while you're working for some of those long-term items. And sometimes the short-term ones are extremely effective in the short term, right? So don't dismiss them because they seem like, well, that's just a phone call, or we just needed to send an email reminding people of our current practice or procedure. That's still a recommendation. Your team still made action on it. And then I went deep on the recommendation one. And then the other item is we have a next of kin interview section. And the next of kin interview section is available to sites that have gone through our next of kin interview training, which is free. It happens twice yearly. And once you've gone through that, you get access to the next of kin interview section. And some of the questions within the next of kin interview section are parallel to those in the case information because you don't know sometimes where the source might be. So a question that would be similar in both is the question I mentioned earlier. How many known non-fatal overdose events occurred? Your next of kin might say 6, and your providers around the table, they came up with 4. So you want to be able to capture and show that, oh, all those people around the table got some of them, but not all of them. Or next of kin knew of 2 more, right? It's just like a data validation and just also another understanding. A question that is going to be in the next of kin interview that is not going to be in the case information is something like, I don't have the question exactly in my head, but something along the lines of, um, what were some social activities or social supports the next of kin or the decedent had? Or did the decedent live with anyone, and did those that they live with also use substances? Just trying to show the social use and social connectedness. So those are some pieces to kind of delineate, but you will have some that are overlapping to validate. So those are the 4 forms. And questions about those? Okay.
Hey,
Yeah.
Melissa, quick
Yeah.
question. I know that, and this might be something you're getting to next, but the permissions that the local OFRs can grant for others, is that on a module by module basis?
Really good question. So typically we do it across board, except for the next of kin, because the next of kin is one we really want to make sure you're trained in before you go and start entering data or feel compelled. So in general, what we say is you sign, and we can share the form, but if you have specific parameters like you don't want them or you do want them access to just some, you just need to make that very clear in the table. But what we can't do is in the case information section, which I'll show in a minute, I think it has 17 sections. You can't say, I want to give Sarah Patrick access to section 14 only of case information, right? So you get access to the whole thing, whole project, or you don't. Okay. The one thing I just want to share, which isn't really what you want to hear, but I want to say. So you have an OFR, and let's say your OFR says, we needed to really have grief support, bereavement support. And you have a recommendation noted over here from a meeting 2 weeks ago, okay? That is still a recommendation of this review. You don't go, oh, we didn't write it down because we've already acknowledged that we need that. Okay. Part of the review process is to help you prioritize and determine the scope at which your recommendations will reach. So even if something has been mentioned out of 3 out of 4 cases, you still want to document it as a recommendation from this case because it will help you when you go to prioritize your recommendations, that it still needs to happen. Having said that, let's say you did a recommendation around, let's say you had a recommendation around, we want to provide bereavement support through the medical examiner's office to individuals who, who are loss survivors. And let's say you did a big push like a year ago, and now you're reviewing a case that happened after that. You still want to, and you found out it didn't meet the needs, that recommendation can help inform what needs to happen with your already implemented recommendation. So you want to keep track and still write down things even after you've done something to see if that recommendation met the need or if you still need to do more in that space. Okay. Okay. Those are the 4 modules. The one thing I haven't mentioned about all of them, and then I will go to actually showing them, and then we can talk about how do you get access, is they are designed with the fact that we know while it is large in scope and is built by the field for the field, it is ultimately designed for the local OFR's use. So if there is an item that is important to you to capture that isn't captured in this already existing standard tool, we can add questions. They're called site-specific questions. You can add them in all 4 modules. So you could add them in your next of kin interview section. You can add them in the county profile. You can add them in the recommendations, and you can add them in your case information. And it could be something like, and poor Natalie's heard these same examples over and over, but it could be, we really want to know if they were wearing purple on the day of their death. Okay. If that's important to your team, we can add it. We just need to know you want it added. And then we are going to code it in a way that it's standard across all the other questions, so that no is 0 and yes is 1 and things like that. So if you have a desire to capture specific information and it's not being captured, that doesn't mean, oh, shucks, we can't do it. It just means you need to work with us and we'll put it in. Okay. All right. Any questions before I show you what it looks like or what it is? Okay. So the OFR data system we designed to be housed within REDCap. REDCap is just a software tool, just like, Excel or other things. It's a software tool. So the OFR, what we're offering you is, its official name is the OFR Data System, but it's being used on the REDCap platform. So people often say, do you have the OFR REDCap data? It's just it's the software we're using. So REDCap, we chose it because it's free. It's relatively user-friendly once you get into it. It's HIPAA compliant. It's online, so you can access it anywhere through a password and username. It's not something you need to install locally. And there are 3 different ways you can access it. You can, if you have REDCap already existing within your agency, you can get the project files and you can install it and use it locally. Or what we're seeing is a lot of places, it just makes more sense. You can use it on our server here at IIR. And so I'm going to show you what it looks like on our server. The way it's designed is, if you use it on ours, it's free. We're responsible for all of the maintenance. We're responsible for the upgrades. If we do a version 2 to a version 3, we will assist with that transition. We are literally just building, as I describe, an apartment complex that you are bringing your data to store. So if you think about it, we built an apartment and you can come and bring your stuff and store it in an apartment room. But the stuff is yours. Your data is yours. We're just giving you a place to go for free. Okay. So at any point you can take your data out. It's your data. We're just hosting it. We're just holding it somewhere. Does that make sense? That's a question people often ask. So the way we describe it is, we're like the landlord superintendent. You get locked out, we got a key we can give you, right? If there's maintenance that needs to be happening, we're responsible for it versus you. Having said that, no one else has access to your apartment room with a key, right? It's not like your neighbor has your key. So you have your own spot, your own place. You bring your stuff in, you take it out. Okay, we're just hosting it. Having said that, I'm getting in a little bit into the data parameters, but let's say someone wanted to know how many people had a red couch in our apartment. We could say, well, we have 47 units, and of the 47, 23 have red couches. But I could never say a specific county has a red couch. Okay, so we can talk about the data as a large group, but I can never present the data to talk about your data. Does that make sense to everyone? So that is the parameters in the agreement, which we can go over a little bit more. But if you sign on to use the data system, the other thing to keep in mind is, on the IIR server, we've made it de-identified. So we've removed personal information, personal identifiable information from our version of the data system, so that we can't figure out who that person is that you are reporting on. You, though, will be given an Excel document that's a crosswalk. So every time you open a new case in REDCap, they give you a generated case ID. So the first number is kind of like your apartment number, your data access group number. So it might be like 212. and then it'll say 212-1, 212-2, 212-3, okay? That's saying this is your data group and this is your case number. So we give you an Excel document where you can put that REDCap generated number in, and then we give you, you can modify it as you want, but we give you a template. First name, last name, address, date of birth, medical examiner ID number, death certificate number, whatever you want to put there that you have for identifiers. But we don't have them. So then that way you go and you go, which number is Susie Martha? Oh, she's 212-7. And then you go into your 212-7 and you write your information in. Does that make sense to everyone if you're familiar with that sort of process? So that is one way that we make sure that our data is de-identified enough that we don't know who it is, but you do for your purposes. All right, I have to just ask my husband, I'm so sorry, to get our cat who's at the back door because he snuck out and he hasn't been out for 4 months. So excuse me. All right, now I'm back. All right. And it's very cold here in Minnesota. All right, so I'm going to show you my screen. Okay, so this is REDCap online. This is giving you access if you're on our server. So you will get a username. Your username is typically your first initial last name, and then you will determine your password. REDCap, if you're not, how many have seen REDCap before or played in it in any shape or form? Okay, like 4 that I see, maybe more of you. It is not like the most attractive user interface, but it gets the job done. Okay, so when you go to REDCap, it is administered through Vanderbilt University. They have a lot of resources available embedded within the platform where you can go see videos and how-tos. We also have some videos that I can show that are specific to the data system, but they really want this to be usable by people. So they try to make it relatively easy. So you will log in. And once you log in, yours is going to look kind of like this. It's going to be this bottom listing here. So here's where you have your OFR case information. We also have a practice case information where you just put in pretend data and get a feel for it. Here's that county profile I mentioned. Here's the OFR recommendation monitoring I mentioned. And then here's the next of kin interview with the practice next of kin interview. So when you start working with us to get online access, we typically let you go play in the practice for a while so you can get familiar with it. And our request is you really have to make sure it's pretend data, okay? Because anyone can see this. It's really just designed for you to learn how to navigate. So this is where your projects will be listed. When you get access, you click on it. We're going to go here. And it's not going to quite look like this. This is what it looks like for me. So I'm just going to grab like this one, see what happens. Because it's practice, it will just be pretend data. So when you log in as a user, this will show you all the people currently on the IIR system using this platform, this project, okay? It will show you number of records in the project, most recent, none of that do you probably care about. You are going to hang out mainly over here. So first and foremost, when you join into a project, I like to go to the record status dashboard. This will show you all the records. Oh, I'm in the next of kin. Why did I go to the next of kin? Sorry, everyone. Let me go back to my, see, this is so you can practice. If you ever want to go to a different project, you go up here to My Projects. And you click on it, and then you can click your new project. And again, I'm going to be Karina, just to be Karina. Whoops, I'll be this person, I guess. Okay. So when you go in, you can go to Record Status Dashboard. When you go to Record Status Dashboard, you will see how many records you've entered in and how complete they are. So here is that room number, apartment number with the case number. These are all the different sections of it. They all have a corresponding link and an update of the information. So when you go in and enter information, at the end of every page, you get to color code it. And you can say red, yellow, or green. Red means I went in, but oops, I got called to go pick my son up at school. I got to close it out. It's red. I got to go back and finish it. Okay. Yellow is I'm pretty much done, but I just need to check that one date. So I'm going to make it yellow to know I need to go back and deal with it. Green is it's good. I got all the information we're going to have in there. It's closed. Nothing means you haven't saved anything in it yet. So in this pretend case, you can see they started filling in some information. They completed this one and they've done none of this. You can navigate multiple ways. You could go directly into the actual case by clicking here, or you can go and click any of these items here and jump to it. So let's say we had some trauma history question information. We're post review. Did they have, and were they known to have any of these trauma or violent events? Oh, yes, they had an incarceration of a family member. Okay, when did this decedent experience this incarceration? It was in their childhood. Okay, that's all we're capturing, okay, for this one. You can put here every section within allows you to type notes. So you could type notes saying incarceration of father, whatever, of dad, right? You can put a note about it, okay? You can put something like need to double check about substance use in home. So you can use it to both do a good job of tracking where you are with your status of your data, or you can use it to add context to the data you entered, okay? And then if I had just checked this, I would say, oh, it's green, I'm done, and I would do green, the complete. If I still needed to check on, whoops, that's the wrong thing. If I still needed to check on substance use disorder in home, then I would go here and do the verify because I want to go back and check the record. Does that make sense to people, how you use the notes? What we cannot have in here is you could say brother of case 21-2, but you cannot say brother of case Susie Martha. We do not want any identifiable information in here, okay? So let's say I'm going to say it's complete. I'm going to save and exit. When you go, it brings you back now to this record with all the data pieces because you're in it, and it turned to green, okay? This can be changed at any point. Let's say it was green and then you get a call from someone who wasn't at the review and they're like, oh, did you know about X, Y, and Z that I'm sorry I didn't bring that. You can go in and change the color or change just, go in and update at any point. The status doesn't mean like it's closed. It just means for your own record management. Okay. But you just navigate through these little circles. Most questions have a parent question. So the location, it was in their residence. The state of the overdose, it was in Illinois. I mean, and so if you see once I clicked Illinois, then the counties came up. Okay, so there are parent questions within it and then skip patterns. So you just kind of have to, again, you don't have to fill in anything you don't either have access to or don't know. And then I'm just going to save, unverified, I'm going to save it. So it's pretty intuitive. We do have, in addition to this, we have a demo video on our website, which we can send afterwards that reminds you even how to get to this part of the tool. We also have a guidance document. So if you're like, ooh, I don't know how to answer this question, you can go look through the guidance document and see our suggestions for helping you understand how to answer it. If that isn't helpful and you need help, you can reach out to us and say, I'm really unclear about what to check here. Okay, and then we can process with you, and then that helps us make sure our guidance document is guiding you appropriately. The guidance document is not meant to be, you don't please pour a cup of coffee and read the guidance document or you're gonna fall asleep after page 4. It's not meant to be read. It's meant to be go to when you have questions. I know I'm probably taking way more time than I'm supposed to. So anyway, so that's how you navigate within a section. If you wanted to go back and To see all your records, you would click on record status. If you wanted to add a record, you could do it here, or you can do it here, add a new record, and then you see it started a new record for me, okay? You just want to make sure when you add a new record, you're updating your crosswalk that you have so you know who this is. When you want to go to other projects, you go up here and you go find your other project and you do like county profile or whatever. So it's pretty intuitive. There's not a lot of clicks. You can't screw it up. You can't delete records. We can help you with all of those things. We want to make sure that you can get what you need out of it. Questions about that before I go to how do you access it and the process involved? Okay. So to access the data system, Natalie will be your point of contact primarily. We have a register to use the data system that just initiates our pathway of connection with you. Once you fill that out, you get an email from Natalie saying we'd like to schedule a call with you. We do a little bit just check in so we know who you're going to want to give access to. Talk through our process. We've talked through our process quite a bit here, so you might be able to reply and say, can we skip the meeting? And we'd be like, yeah, we can. But that's typically what happens. I think it's sometimes helpful if you have other staff who aren't here or leadership that you want them to be able to hear or ask questions. It's a good time to have a call. So once you've done the register, we reach out to you. Then you get a data use agreement. A data use agreement is a pretty standard MOU, Memorandum of Understanding, between you and IIR saying we have a repository that is safe and secure for you to store your data. We don't own the data, you do. And it talks through a lot of the pieces about what rights that we can analyze the data, but we can't share out specifically your site's data. It makes it really clear the parameters of the agreement, like of those pieces. It's a pretty boilerplate. It works for most places. Most agencies, county and state, don't find they need to tweak the agreement. If your legal does have a concern, they need to use track changes and send it back, and then we work with our legal to make sure we can find an agreement that works for everyone. In that agreement, it will ask for your authorizing agent to sign the overall agreement. That is for you to deem within your agency who the authorizing agent is. It varies in different places. Sometimes it's the unit supervisor, sometimes it's the county commission. Like, it really varies. You just need to know who needs to sign MOUs like this. And then we have a table on page 8, and I'm going to show it to you really quick here. This is where you get to decide who actually is going to be getting access locally. So this is the agreement. As I mentioned, you change the site in the places where it's highlighted. Here is where you have the authorizing agent sign that you agree to these components. Here's where we list the data that we remove from the standard tool to make it remove a personal identifiable information. Like, you can't even enter it if you tried. And then here's where you're going to list who from your site do you want access to the data. We don't know if they're contractors. We don't know if they're external evaluators. We don't know if they're state folks that you've authorized, but this is who you say can have a key to your apartment room. That's more or less how I think about it. Okay, who do you want to have a key? We encourage that it be those who need access, but no more than who need access. Don't get too many cooks in the kitchen. Your data is going to be cleaner and better to use with only those targeted to use it have access. Having said that, let's say you put 2 names down and you realize you really need this third person to be added 6 months later. What you do is you just add them 6 months later, initial it and date it, and scan it back and send it to us. And then we know, oh, we need to now add Samantha Rose. Okay. If George Johnson quits or gets a promotion and doesn't want access, you don't want them to have access anymore, you do the opposite. You draw a line through George Johnson, whatever name I made up. You initial it and date it, scan it back to us, and Natalie knows to like suspend or end their access use. We don't need to go through the whole entire like document again. If you're getting rid of all 3 people and there's a new person, we might want to revisit with that new person what they're agreeing to and do some onboarding with them, right? Because it's a whole new change of contacts. But that's it. Once we have that, then Natalie authenticates the account. So she starts authorizing the accounts for everyone. And then we typically reach out and say, can we get on and do a demo? And really, we want to make sure everyone who got the email actually gets on and does it, because sometimes we find 1 out of 3 people never got the emails, never clicked on the email. We need to make sure you all have access. And then you also get invited to our data user group, where we meet every other month and we talk about opportunities related to the data system. We ask questions in regards to how to improve it. We answer questions about how to run a report, because something we didn't get into is you can run different reports off of the data. And then you also get access to a data user dashboard. And this is where we upload tools and resources, and you can go I find things that we've pushed out for you to use. So I think those were Natalie, did I miss anything critical or key at this point?
I don't think so.
Okay. So we've gone over how it was developed and why it exists. We've gone over what kind of data elements or types of projects we have. We went over how the interface works and the general like access overview. And then we've gone over how do you get access to the system. And then once you request access, the process from that point forward to get into the data user group fold. Anything else? Anyone? Indira, Sarah, did I cover everything?
That was incredibly thorough. Answered any questions I might have had.
Okay, you're probably like, you went a little too into the weeds, but
No. It was wonderful. Yeah, Pony, I see your comment. I'm going to be sending out a follow-up email. Yeah, you can definitely drop your emails there, but I will include their emails there as well, so you can contact them, as well as some other links for registering for either REDCap or for signing up for the data user group dashboard. If nobody has questions, I did have a couple. At the moment, not all Illinois teams are using OFR. I don't think any OFRs in Illinois are using REDCap yet. But segueing into that, we are currently working on a NOFO for OFRs in Illinois, and that will be released soon, which is why we really wanted to have this training session on REDCap, since we would encourage our grantees to use the REDCap system, ideally hosted through IIR. So having this training would really help with that. And also, along with that OFR NOFO, we would like your input as to what kind of data you could share with the state. So I will be giving a survey link in the follow-up email, and you guys can just give us your feedback. It's a very brief survey, less than 5 minutes. So hopefully shouldn't take too much of your time, but I'd really appreciate your feedback.
2 comments to that, just to add. One is, do the survey, don't do the survey. It's completely up to you. It's just to help us have an idea of what variables people are most interested in looking at, because when we're talking about sharing the data with the state, what we're really talking about is just trying to have a roll up of the different options or the different recommendations in particular, so that from a state perspective, we can say across the state, when OFRs are meeting, these are some of the recommendations. And our goal is to help put funding towards some of those, how do we find funding, whether it's funding through our overdose data action state grant, or whether it's finding other sources of funding. But we want to keep supporting you in different ways, and knowing what those recommendations are, what the priority recommendations are across the OFRs is really important to us. But it's completely up to the sites on whether or not they would choose to share that with us. And again, it's completely separate from scoring. We won't know anything about who answered those questions in that short survey that Indy said. So nobody's going to be penalized for saying, yeah, we don't want to give you anything, Sarah, and no one's going to be getting special bonus in their scoring when they put their application in, because obviously there's communities who might be interested in putting in an application that are not here today. And it's one of the reasons I asked Indira to record this, so that everyone has access to the information. Plus, Melissa and her team have really great recordings from other trainings they've done. So there's a lot of information there. And just want to thank you, Melissa and Natalie, for being here with us in Illinois. We're at a really critical, exciting point, and we just can't wait to keep moving it forward. Thanks.
Yeah, no, we're excited. And even though I did all the talking, Natalie is the one who gets everything done. So she's amazing. And I will be quiet. I see someone else has their hand up.
Michelle, go ahead.
Yeah, I just had a quick question. It sounds like you said, Indira, there's going to be funding made available through IDPH. So this is separate funding from COSIP. I just saw that there was some more funding available through COSIP. So this is totally different that might be coming out through IDPH.
Yep.
Fantastic. Great. Thank you.
Yeah, that'll be posted on eGrams. Any other questions or updates from anybody?
If I can just say one thing in summary, if you have any questions along the way, navigate, obviously, whoever, right? If it's state related, and Indira can loop us in, or you can come directly to us if it's about like, now what form do I fill in? And we can loop in Indira and Sarah as it makes sense from our, whatever. But it's a no wrong door. Go wherever you are. We'll channel you to the right. And just because we presented it today doesn't mean that we won't hop on a call locally and help you navigate your own internal leadership's questions or anything. So it's not like this is the only chance you got to process or ask questions, is all I want to say about the data system.
I also want to share a plug for the community of practice that they run, because that is really fabulous. I mean, literally, I've been in tons of data communities of practices in my life, and you guys really answer the questions. It's really communal. People share with each other, oh, this is how I did this, and so they're very helpful.
Okay. All right, it looks like everybody's got their questions answered. So since we're almost at the top of the hour, I don't want to take anybody else's time. I know everybody's very busy. Thank you so much for being here, especially Melissa and Natalie. Thank you so much. This has been a fantastic opportunity to learn more about REDCap. That being said, I will include also a link for the data user meetings in that follow-up email if you'd like to hop on those calls. And thank you, everybody, for being here today. Happy Monday.
Thank you, everyone. Have a great day.
Have a great week.
Thank
Bye.
you. Happy Monday.
Bye.
Bye.